Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions and addresses the latest COVID news right here on the Havey Institute for Global Health's Facebook page every Tuesday and Thursday. And today, Dr. Murphy will be answering your questions and addressing the latest COVID headlines through today, the 12th of April. And should you have a question, feel free to send it to us via email at globalhealthinstitute@northwestern.edu. And leading the discussion again today is Sophie Buskowski, who is a student research assistant with the Institute. So Sophie, I now turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy.
Good morning.
Now for some updated COVID statistics. Yesterday in the United States, we saw 49,391 positive new cases, and we are now seeing a 7-day average of 32,139 positive cases. Unfortunately, we are seeing a 10% increase over the last 14 days, and as Dr. Murphy will talk about in a little bit, this number is not exactly accurate. Booster shots are hitting around 30% for given in the United States. Hospitalization and deaths are both decreasing in the United States as a whole, but unfortunately in Illinois, we are seeing a 6% increase in hospitalizations, and we did see nearly 5,000 new positive cases yesterday in Illinois with a 7-day average of almost 2,000. What can you tell us about these numbers, Dr. Murphy? And I'm going to tie that right into our headline of what is the accuracy of these numbers?
Yeah, it's most likely due to a number of reasons. The two big ones are the underreporting of new cases because of the abundance of the over-the-counter tests that now everybody can get at their local pharmacy. So, a person feels sick or they've been in contact with somebody, they go to the pharmacy or they got their free ones sent by the federal government, they get tested, they're positive. They're not that sick though, or they'd have no symptoms at all. They call their doctor. The doctor says, well, you're going to run through this. You don't bother with anything else. Those people are not counted. And I think it's grossly underestimating the number of new cases because most cases are mild, even in the worst situations. It's the younger people, otherwise healthy. That's the bulk of the population. And they're not getting tested. Like when I was diagnosed 3 weeks ago, I got kind of sick, but I didn't have to go to the hospital. But, I had an antigen test. I don't need a PCR test. I ultimately ended up getting one, but that was for another reason. But anyway, these antigen test results, these rapid test results are not counted. So undercounting. The other thing is that, people say, this thing is over. There's going to be no more waves, And so the number of people going to get tested at the testing sites around the country dropped precipitously. And they even started closing those sites because people weren't using them. So if you don't use them, you don't find it. And if you test with an over-the-counter, that's very successful and it's fine. If you have symptoms, you test, you probably have it. And so those two reasons have limited the effect of the number of cases reported. Now, if you get a PCR test, any kind of molecular test in a laboratory, that's automatically reported to your health department. You don't have to do anything. The lab reports that, and they'll contact you most likely. But that part is all automatic. The rest of it is not, and so it's voluntary. They are seeing an uptick now in new cases in the Northeast. Hospitalizations continue to decline, and the death rate continues to decline. But remember, those are very late metrics and markers for how much disease is out there. Remember how the hospitalizations and deaths lagged the number of new cases? Well, they're also not good to pick up what's going on in the communities. So yes, there's a big uptick, and probably everybody heard of the Gridiron Dinner in Washington, D.C. with all the Washington elites, and something like 80 of them have come down with COVID. The most interesting thing about that is that none of them yet have been hospitalized, and obviously nobody has died. So this may be the new way forward. you have big events, you may get a lot of COVID, but nobody gets super sick or, in a situation like that. You got to look at every situation individually. We'll talk more about that when questions come up.
Yeah, absolutely. And this will tie right into our second big headline, which is that Philadelphia will reinstate its indoor mask mandate as cases are rising. What can you tell us about this potential reinstating of mask mandates in the United States?
Oh, this is happening. This is going to happen. I mean, you can't, there's just going to be cases all over the place now with this Omicron variant. The BA2 is so highly contagious, and you're going to have a lot of cases. And Philadelphia has done the right thing. I mean, and they said it themselves. They said, we're not following the CDC guidelines because in Philadelphia, we're seeing a lot of cases. And so they put the indoor mask mandate back in place. And I think this is going to happen everywhere. This is really just the beginning of changing policy. You'll see some of the more progressive states take this same picture as they start really appreciating how many new cases that they have.
Yeah, absolutely. And our third big headline is that, quote, we cannot let our guard down, quote, a top Chinese health official tells Shanghai residents under lockdown. What can you tell us about what's happening on the opposite side of the globe?
Well, the Chinese have taken a very different approach to this, and in some ways it pays off, and in some ways it doesn't. One is that their serious lockdowns and everything have made their overall case rate, incredibly low, lowest of any of the industrialized countries, and very few deaths considering their very large population, over 1 billion people. However, they haven't done that good with the vaccines. Number one, their vaccines are not very good. They're okay, but they're not great. Our vaccines are actually considered very good or great. Theirs are good. So they don't have that effective a vaccine. And in the US and many other wealthy countries, the older people tend to be more heavily vaccinated because they know they're the ones that are going to pay the price if they get this infection. In China, it's the other way around. The older people don't want the vaccines. I don't know. In Hong Kong, we know they don't trust the government. But in the rest of China, I don't know what the story is there, but the older people are relatively unvaccinated. So if they just fling the door open in China like we've done here, they're going to have a massive increase in deaths, just like Hong Kong, maybe for a slightly different reason. So they're between a rock and a hard place. So they shut Shanghai down. Shanghai is their industrial commercial center. This is going to have a serious impact on Chinese productivity if they have to keep doing this, and most likely they will. And so they've got a big job on their hands now to vaccinate more people. There's other things they can do. They can get into the therapy business like we are here. Matter of fact, in these very sick people, we actually have a new therapy results were reported yesterday. Sabizabulin is an oral drug by Vero Inc. Had a clinical trial, relatively small, about 150 people, in sick people. So this is like remdesivir, the drug that they give people in the hospital, but it's an oral drug. So hospitalized people who needed oxygen got this or placebo, and the death rate was significantly lower in the treatment group. So if the trial was stopped prematurely because of this phenomenon. Of course, they have to do bigger studies, but they're submitting this information to the FDA, and we'll see where this goes. But this will just be yet another thing we can use to lower the morbidity and mortality of this horrible disease. So stay tuned, because remdesivir, although it works, it doesn't work that well and has never shown a death benefit. It's always been a combined endpoint of how many days in the hospital, how many people on a ventilator, how many people, got this, that, or whatever. There's 8 different endpoints. in the study that they did. It works, but this has a death benefit. This is quite remarkable. So this could be a big game changer. It's just another one, and we're going to see more therapies come like this as well. So they can use stuff like this.
Yeah, absolutely. And that ties really well into our first COVID question, which is it safe to be traveling and eating inside for Easter and Passover this weekend? How should we be treating the celebration with family and friends as people are traveling?
Well, big holiday coming up, a lot of people moving around. It's the same kind of answer we've been giving all along. If you hang with a group, your clan or friends or whatever it is, and everybody's vaccinated, particularly if everybody's vaccinated and boosted is even better, you should be fine. Now, as long people obviously have to feel well, if they're sick, they should not be attending any of these kind of events. Right. But if you hang out with vaccinated people, your risk of transmission, your risk of getting anything is just less. Now, if you have some very severe immunocompromised disease, organ transplant, high dose steroids, your doctor will tell you, or yourself already, you need to rethink that and keep your travel minimized and keep your interactions with other people minimized. So it's not no right or wrong, but you have to put yourself on a line of what your risk is and how much is it worth to you to put yourself at risk. A 90-year-old person with some heart disease and stuff, you don't want them in a group, really. That's really going to be a private type of affair to be safe. But if you have a question, your doctor can advise you, and there's plenty of guidelines out there that you can follow, which I just summarized.
Yeah, absolutely. Now for our second COVID question, this individual is attending a large indoor gathering with about 150 people, and they received their COVID booster on October 20th of 2021. They are a breast cancer survivor and have been in remission for 5 years now. Should they be getting the booster now? Should they wait and not attend the event? And would you attend the event with or without the booster?
Well, I'm not really sure when the event is, but I would get the booster right now. This person is high risk, past cancer. And I would get the booster right now, but I would say that otherwise it would be safe to attend the event. But again, it's not like there's no risk. So, maybe attend the event wearing a mask, except when you're eating. There are ways that you can minimize your risk even further.
Yeah, absolutely. And now for our third COVID question.
And let me add to that.
Yeah.
If that person gets sick, they're high risk, no matter what their age is, they can get Paxlovid, the oral drug for the outpatients. But remember, you have to take that within 5 days of getting your first symptom. So you can if you get symptomatic, you can have a rapid test that's positive, get Paxlovid. That reduces your chance of getting serious disease even more.
Wonderful. Now for our last COVID question. I have a friend whose boyfriend tested positive yesterday. He had Delta a very long time ago, and now he likely has the BA.2 variant. My friend is a little over her 90-day mark of COVID immunity, being that she had tested positive January 11th of 2022. Should she also be isolating?
So I understand that this person is vaccinated and then had COVID. And so this is a hybrid person. So this person is pretty protected, pretty immunologically protected. And there's no magic about 90 days, whether it's 100 days or 92 or, it's not like it just plummets off after 90 days. So I think that this person, according to the current guidelines, they don't have to isolate if they're asymptomatic. Now, what they can do is they can go ahead and test themselves. This is what happened to me actually just a couple of weeks ago. The person I had dinner with informed me that they were sick and had a test. It was negative. And then 2 days later, they said, oh, no, it's positive. I tested myself, had no symptoms, positive. Then I got sick. So, you can do that too. You can use these tests, use them. They're tools. They're just another tool in the toolbox. You don't necessarily have to go get a PCR test. These things are now freely available. They're everywhere in the pharmacy now. So you could do that as well.
Yeah, absolutely. Well, those were all of our COVID questions for today. Thank you, Dr. Murphy.
Well, thank you and have a good day.